Okay, welcome to the next section of Rest and Recovery. Still in Module 2, we are talking about exercise and sex now. So, after childbirth, our bodies have been through so much, and while we want to heal, I know that we also want to get back to ourselves and get back to normal activities as we were before. So, I guess the big question is, how will we know when it's safe to try exercise or being intimate again? So the short answer is many people get cleared for exercise and sex at the 6-week follow-up appointment. We will talk more about this appointment in a following video, but that is usually what happens. The doctor checks to see if you're healed and usually gives you the green light. They don't necessarily do an in-depth or intensive evaluation. They just kind of see if your incision and stitches are healed. So the longer answer is it depends. So it depends on your level of birth trauma, level of tearing, if your incision is healed, if there were any complications with your healing, if you have diastasis or prolapses, and you may not know these things yet. So you really do have to be your own advocate and listen to your body and listen to yourself, because a doctor may technically give you the go-ahead, but if something doesn't feel right, it might not be right. So when you do get back into exercise, it's really important to start slow, and you can always increase your intensity. But if you hit the ground running, literally, you could potentially pay for it later. So start with light exercise, walking. I mean, you can do some of these things before the 6-week appointment. I definitely started going for walks before that. You can do some yoga and stretching. I would probably wait till after 6 weeks to do more calisthenic type things like bridges. And the bridges that I have done have been either with feet on the ground and then you lift your pelvis up, or feet on the wall and you lift your pelvis up, because those don't really challenge your abdominal muscles really. And they are good for postpartum healing. You can also start with light weights, but consider how you were before. If you were somebody who was running before, and maybe even somebody who was running throughout their pregnancy, maybe you can get up and at it much sooner. But I do think that the majority of people are not in that boat. But yeah, if you were somebody before who was doing CrossFit, who was a yoga instructor, who really had a higher level of fitness, then also listen to your body in that way, but be cautious, because just because you could do something before doesn't mean you should necessarily jump back in it with the speed with which you were doing it before. So then if you know that your body can handle it, or after you have kind of ramped up slowly, you can increase to higher intensity exercise, which would be considered running, CrossFit, HIIT training, even jumping on a trampoline. I don't I don't think that I could have done that right after giving birth. I mean, at the time of recording this, I'm about 4 months out, and I don't think that I would want to do that right now. Elliptical is probably in between. So it kind of depends on how hard you go on the elliptical. Elliptical could be low intensity, but if you're really going after it, it could be higher. Heavier weights and kickboxing, and I'm sure I missed some things. So how do you know if it's too much too soon? I really want you to keep an eye out for the following. So if you do exercise, or maybe even sometimes it could be triggered by even going for vigorous walks multiple days in a row. It could trigger extreme weakness, feeling like your muscles and limbs are weighing a ton. Signs of prolapse, which aren't as obvious, but if you feel a full feeling down there in your pelvis, or a downward pressure, or feeling like any of your organs down there kind of want to fall out, they're probably not actually falling out, but if you feel that feeling of downward pressure, that could be a sign that you are putting too much pressure down there too soon. Also, lightheadedness or dizziness or nausea, that's a really good sign of you did too much too fast. And I think, many of us can relate to that feeling of if we've done a workout before eating and then we kind of feel a little out of it, a little foggy, a little nauseous. you may need to back up a little bit. But whatever you do, be mindful about it. Listen to your body's cues. You can be physically cleared by the doctor, but I've been saying it and I'll say it again, you know your body better. So listen to your body's cues, take breaks, take rest days, because even in the beginning for me, like I went on a walk 3 days in a row, and the third day I felt so weak and almost foggy. And I was like, oh, maybe I need to have a rest day in between even doing walks at first. So remember that you're healing. So we always need to be kind to ourselves, and we'll get into this, but not watching the scale too closely is really important during this time, because with everything that you're dealing with, going through right now, the last thing you need to do is feel like you need to be back to your prior weight, or even back to a weight that you were years before. We put a lot of pressure on ourselves as women, and watching the scale too closely right now is just not a good idea. Because then we can fall into the body back mentality, and fitness influencers sometimes can prey on this with new moms, right? Like, do you want to get your body back? Here's how, So, and this can lead to disordered eating and over exercising. So exercise bulimia is when you exercise to the point of trying to earn back calories that you ate, or you exercise in advance of earning food later. So this is clearly involved with counting calories, because you're counting every ounce that goes in, which means you're likely shooting for a very low target of calories for the day. And in order to earn a glass of wine or dessert, you're over exercising to, quote, earn it. I did this before I ever had kids, and I got to tell you, it did not work out well for me. I became obsessed with numbers. I was counting at the dinner table. I was spending so much of my waking hours thinking about when I could eat next, how much could I eat next if I go to the gym and stay on the elliptical for this long, how much wine can I have? It is damaging. And so that, along with just even counting and cutting calories in general, when you're in this postpartum period, please give yourself some grace. And if you find yourself slipping into some of these disordered tendencies, talk to someone. I didn't. And I didn't necessarily at the time see the disordered aspect of it. I thought I was disciplined. But in the end, it actually didn't give me the results I necessarily was even looking for. So let's move on to sex. So unless you've had some severe tears, incision complications, or other birth injuries, you will likely be cleared for sex at your 6-week follow-up appointment. So my advice for this time period after you get cleared is to maintain open communication with your partner. Setting expectations for sex and, is really important, because you might have boundaries that you didn't even have before. But now, especially if you're going into it very cautious like I did, your partner may not know that. They may not realize that. They may hear, oh, you got the green light from a doctor, so obviously it's going to be business as usual. You can do everything that you used to be able to do, and you're going to be totally comfortable with it. But not only are we healing, but we also may have different emotions surrounding being intimate. We are with these little babies all day, and we may be kind of touched out. There may be things we don't want to do. And our partner has no way of knowing that if we don't tell them. So really communicating our emotions and our boundaries with them is so important. And, discussing birth control methods before you get intimate is important, because you may have had a way of doing things before, and especially if you feel that your family is complete, you need to talk about birth control options, because some people don't get a cycle back for a year. Some people get one back right away, and there is no way to really know. So you need to be careful if you don't want to get pregnant right away. So communicating once you're in the intimate situation, communicating pain or discomfort is really important because I think that, we feel, or I don't want to speak for everyone, but some people feel that, their partner has been deprived in a way of intimate experiences, at least for the last 6 weeks, but maybe even for the end of your pregnancy, especially if you were on some kind of pelvic rest. So someone might feel a sense of, you don't want to speak up or say anything if it hurts or it's uncomfortable because, then you'd be stopping them in the middle of something. But my advice is to not endure it. And if you have set up the expectations ahead of time that like, hey, this might hurt. Hey, I may ask you to stop. Most partners, I think, will be really understanding, especially if you let them know, like, this is not about, you or me not wanting to do this. It's about, me healing. And if it hurts, does that mean that I'm messing something up in my healing? Like, am I irritating something that really shouldn't be irritated? And in that regard, if you do feel ahead of time that you're not really fully healed, maybe that's a reason to not get into it right away or explore other options beyond intercourse or the things that you would normally do before intercourse. So some things to remember here is, for the most part, I'm sure your partner wants to support you in your healing. They are here for you because in the long term, it's not good for anyone if you're not healed. So, and also another thing to remember is this is actually supposed to be fun. So if it's actually causing a lot more stress, then maybe it's time to take a break. After my first child, the first time we tried anything, my healing for my first wasn't quick anyway. It was my hardest healing. And after we tried the first time, we actually took a break for several weeks. It wasn't like the first time, then it was like back to normal. We actually took a break after that because the first time didn't go that well. And that's okay. Everyone's different. You have to listen to your body. You don't have to adhere to anyone's timeline but your own. Okay. And ultimately, once you're healed, it's actually not normal to have painful sex after childbirth. So it may be common, but that doesn't mean that it's normal. And so that might mean that you might need to get checked out again, or you might need to give it a little bit more time. And that's okay. And it is okay to change your mind, and it is okay to rescind consent. And just because you're married to someone does not mean that you automatically consent to sex. Please remember that. So some things to consider as a checklist. Okay. Did a doctor actually check your incision and or pelvic region for healing? Because sometimes at the 6-week appointment, if they're in a hurry, they might try to get away without actually checking you if you say you feel good. But I really think you should actually be checked. Do you feel comfortable in your own healing to begin exercising or being intimate? So regardless of if you've been cleared or not, do you feel ready? And have you communicated expectations and needs to your partner? Very important. Ultimately, you need to trust yourself. Only you will know if you're ready to try. If you're still unsure and you don't necessarily trust yourself that much to know for sure, there are professionals whose job it is to help us figure it out. And those would be doctors, maybe a urogynecologist, maybe a pelvic floor physical therapist. Those are people that can help us figure it out if we're really ready or if there's something else going on. So, you're out of the woods. I mean, for the most part, I would say most people on average are mostly healed, a lot of mostlies in there, by the 6-week mark. And, hopefully that's the case. It's not always the case though. Some people do have more in-depth healing being needed to do, and that's okay. But by the time you're cleared for exercise and sex, hopefully you have completed the worst or hardest parts of your physical healing journey. My advice is just to take it slow, because you don't want to regress in your progress by doing too much too soon. Next up is something I'm very excited for, things they don't tell you. We're going to dive into things that most moms seem to find out on their own after they give birth. And I'm here to try to break the stigma on that and reveal some things that you may not know. See you then.